My name is Ariel Loop, and I am a registered nurse from Los Angeles. This past January, my firstborn son Mobius got sick for the very first time. He was only 4 months old, and measles was barely on my radar. I had spent my pregnancy concerned about the whooping cough epidemic and got myself vaccinated while pregnant in an attempt to pass some immunity on to him. My husband and I ensured that everyone who had contact with him during his first several months of life was vaccinated. We hardly left the house before he was old enough to begin getting vaccines. When he was a preemie born during the fall, and we took every reasonable precaution to keep him safe. On January 31st, I had an unusually difficult time putting my happy little low-maintenance baby to bed. He just kept crying and crying to the point that I ended up in tears myself because in the 4 months of being his mom, this had never happened. Every time he'd finally drift off to sleep, he would wake up almost immediately rubbing his eyes. I thought maybe he was having an allergic reaction to something, and I went through a list in my head of anything that it might be. He woke up the next morning feeling really warm to the touch, so I undressed him while my husband got the thermometer. His fever was over 102, and my mind immediately went to measles. I started inspecting his skin for any spots, dreading what I might find. I turned him over and found speckles on the back of his head. I couldn't believe it. I was in completely disbelief. I had actually convinced myself for the first few hours that morning that I was crazy. This was just the first of many first-time mom concerns that would turn out to be nothing. Several phone calls to the pediatrician, 2 doses of Tylenol, and 3 cool baths later, his fever was still rising. The spots were spreading to his face and chest. I knew it was time to head to the emergency room. I called ahead to notify them that we were coming in. Measles is highly contagious, and the idea of potentially passing it on to someone else waiting for care worried me. When we arrived, they gave him a mask and whisked us into a seclusion room through the back entrance. A few hours and several invasive tests later, we were sent home with quarantine orders from the health department. We got the results later that week. My baby had measles. Mobius spent the next several days sleeping for 10 to 20 minutes at a time. He rubbed his eyes constantly. He still is. After growing dissatisfied with the scratches his little hands could deliver, he actually learned to roll over amidst this so that he could dig his face into the mattress or carpet. We were all exhausted. His quarantine was difficult. I had blood tests from nursing school showing my immunity to measles, but my husband Chris did not. My boys were stuck at home for nearly a week. As an added hurdle, I'm in the process of getting my second nursing degree, and this was the week of my midterms. Chris, who works the graveyard shift, stayed at home with Mobius during my 12-hour days, got a couple hours of sleep, and then worked his 10-hour shifts. It was stressful, terrifying, and we had to go through it by ourselves at home. The days prior to the rash appearing while Mobius was contagious, we were all over town. The public health department had to follow up individually for nearly a month with the 12 friends and family members who had direct contact with him during his contagious period. We got dozens of follow-up phone calls from the health department in the month following his diagnosis. Chris and several of our friends required blood work. Some had to miss work. I can't even imagine the resources that went into our single case of measles. There are numerous personal decisions parents make for their children: disposable versus cloth diapers, formula versus breast milk, etc. Vaccination is not a comparable decision. The choice not to vaccinate your children is a threat to public health. Choosing not to vaccinate your child is making a choice to risk the health of everyone around you. You're doing that intentionally. This shouldn't have happened. Measles is the deadliest childhood illness and was eradicated from the United States 15 years ago. My infant shouldn't have had to suffer. He shouldn't, still months later, be having complications with his eyes. I shouldn't have had to fear for his life. I shouldn't have had to deal with the incredible guilt of having unknowingly exposed hundreds of other people to measles. The thought of being the catalyst for other children contracting measles still weighs heavy on my heart. I shouldn't need to be here today. This didn't need to happen, and I don't want it to happen again.
Thank you. And that has concluded the time for the proponents. We're now going to allow the proponents to, if you can either move to the side and make room for the opponents to come up.
Do it same way with Q&A.
Yeah, sit there. Is there anyone else that's going to be coming up in the opposition? Okay, I've seen, looks like everyone's here. If you could please state your name and obviously your position, we'll go ahead and begin. Go ahead. Yes.
On Honorable Chair Hernandez and committee members, thank you for this opportunity to speak to you today. My name is Tetiana Obuhanic. I hold a PhD in immunology, and I received my postdoctoral training at Stanford University. In my childhood, I contracted measles, despite being fully vaccinated with 2 vaccine doses. My personal experience prompted me to examine peer-reviewed research on measles and other vaccines in much greater detail than what is generally being taught in medical schools and PhD programs. Based on my in-depth analysis of vaccines and the protection they afford, I'm here to testify that families who utilize personal belief exemptions do not pose a significant threat to the public, and that personal belief exemptions must be preserved. First, assuming that the Disneyland measles outbreak provoked the introduction of SB 277, the question is, would it have been prevented with SB 277 in place? According to the Morbidity and Mortality Weekly Report issued by the CDC, at the peak of the outbreak, only 18 out of then documented 1 in 10 measles cases in California were in school-age children with personal belief exemptions. The vast majority of measles cases in the outbreak were unrelated to personal belief exemptions. Please let me now explain the measles paradox, as noted in epidemiological studies. I quote from Poland and Jacobson, 1994, Archives Internal Medicine. The apparent paradox is that as measles immunization rates rise to high levels in a population, measles becomes a disease of immunized persons. Further research determined that behind the measles paradox is a fraction of population called low vaccine responders. Low responders are those who respond poorly to the first dose of the measles vaccine. These individuals then mount a weak immune response to subsequent revaccination and quickly return to the pool of susceptibles within 2 to 5 years, despite being fully vaccinated. Revaccination cannot correct low responsiveness. It appears to be an immunogenetic trait. Furthermore, low responders outnumber those who currently hold personal belief exemptions in California. The rate of personal belief exemptions is currently 2.54%. In California, the proportion of low responders was estimated to be 4.7% based on the antibody titer analysis following the second MMR. It has been documented that vaccinated persons who develop breakthrough illness are contagious. In fact, 2 major measles outbreaks in 2011 in Quebec, Canada, and in New York, were reported by previously vaccinated individuals. Based on these findings, it is apparent that SB 277 cannot prevent future outbreaks. This is because low vaccine responsiveness, together with documented contagiousness during a breakthrough illness in the vaccinated, results in the measles paradox, which cannot be eliminated by vaccine compliance. Second, a big concern during any outbreak of a viral communicable disease is how to protect the immunocompromised. Public spaces can never be rendered infection-free, even when vaccination compliance is high, approaching 99%. For this reason, the protection of the immunocompromised is achieved by administering measles immunoglobulin, or human normal immunoglobulin, upon probable exposure. This process is called passive immunization. SB 277 is not needed for the sake of the immunocompromised because of the availability of the immunoglobulin. Third, the tetanus toxoid and the hepatitis B vaccines are intended for diseases that are not transmissible in school setting. Neither IPV, the polio vaccine, nor the Ascelia pertussis, the whooping cough vaccine, nor the diphtheria toxoid vaccines are capable of preventing transmission of infection. They are intended to prevent disease symptoms only. Attempting to eliminate personal belief exemptions to these state-mandated vaccines under the pretext of pursuing public safety has no scientific validity. Please note that SB 277 would not simply bar unvaccinated children from public and private schools. It would also apply to homeschool children due to California's designation of homeschools as private schools. Since children in California are required by law to receive an education, the bill would in effect force any family who opposes vaccination to submit their school-age children to all state-mandated vaccines against their will. A forced medical procedure is a violation of human rights. About 100 years ago, in 1909, California passed, virtually without opposition, a forced sterilization law, deemed at that time to be for the public good and science-based. This is not the history we are proud of. This is not the history we want to repeat today. Mass media breeds intolerance for a small minority of families who choose to care for the health of their children differently from the mainstream. Such intolerance is irrational. Non-vaccinating families do not pose a unique, or in most cases, any threat to the public to warrant any discrimination against them. My conclusion is that SB 277 is not needed and personal belief exemptions must be preserved. Thank you for your attention.
Thank you. We have about 14 minutes left. Please state your name.
Mr. Chair and Senators, my name is Dr. Lynn Mielke. I'm an integrative medical doctor and am a fellow of the Medical Academy of Pediatric Special Needs. I am the founder of the Developmental Spectrums Clinic in Pleasanton, which serves the medical needs of children with developmental delays, including autism, and I am the mother of an autistic child. As a physician and mother, I am deeply concerned about losing the principle of informed consent in the doctor-patient relationship and my freedom and inherent right to make individualized medical decisions for my child. The core goal of integrative medicine is to identify the underlying causes of medical problems. Like my colleagues, most of the developmentally delayed children that I see at my clinic have many underlying medical conditions, such as gastrointestinal disorders, nutritional deficiencies, mitochondrial disorders, exposures to toxins, immune deficiencies, chronic infections, and autoimmunity to the brain, to name a few. These medical issues make this subset of the population potentially more sensitive to adverse vaccine reactions. For example, there are published studies reporting neurologic regression and loss of basic skills after routine vaccination in children with autism who have mitochondrial problems. Despite this, these children usually don't qualify for a vaccine medical exemption. Unfortunately, there is no current mandate to test each child for underlying medical problems before we vaccinate them. We usually only see them after the damage is done. But sometimes we have warning signs, like a child who loses eye contact or language after a vaccine, or an older sibling who is on the autism spectrum or who has reacted negatively to vaccines. In these cases, we can do tests and be cautious and potentially prevent further damage to that child. In these situations where medical vulnerabilities exist, it is critical that we are not forced to practice government-mandated medicine. SB 277 could increase the number of vaccine-injured children and will eviscerate the doctor-patient relationship and medical-informed consent. Safe vaccination is the goal, but there is no safe, one-size-fits-all vaccine policy. Informed consent is a basic medical and ethical responsibility, and it is at risk here today. A forced universal vaccine program could injure many, and society as a whole, and families like mine and those of my patients will be left to bear the burden. Once a vaccine is given, it cannot be undone. I strongly urge you to oppose SB 277. Thank you for your time.
Chairman, members of the committee, thank you. My name is Stephen Rubin of Portola Valley, California. I am a research computer scientist with a PhD in over 45 years of programming experience. I'm also the Director of Vaccine Research Analytics for the National Vaccine Information Center. The National Childhood Vaccine Injury Act of 1986 required the CDC to gather data about vaccine injuries and make it publicly available. They created VAERS, the Vaccine Adverse Event Reporting System. At first, the data was only available to the public in raw form and was impossible to view. To remedy that, I created the first online search engine for VAERS in 2004, medalerts.org. This website still provides the most complete public access to VAERS and has become the search engine of choice for many researchers, including some at the CDC. There are nearly 500,000 reports in VAERS, and yet the system suffers from underreporting by anywhere from a factor of 10 to a factor of 100. Because Senate Bill 277 removes the personal belief exemption to vaccination for children, it is appropriate to look at the VAERS reports filed for children 18 and under who suffered after a CDC-recommended vaccine. I confined my search to only serious reports where the person was hospitalized, had a life-threatening injury, was permanently disabled, or died. VAERS shows over 36,000 children who were seriously injured after a CDC-recommended vaccine. The chart on page 2 of the handout I have given you shows what happened to them. Our government reports 12,000 visits to the emergency room, 27,000 hospitalizations, and 3,437 deaths. The chart on page 3 of my handout shows the different vaccine components that were involved in these 36,000 reports. The data suggests that there is not a single vaccine that is safe for everyone. Supporters of SB 277 assert that the vaccine schedule is safe, but the data on page 4 of my handout shows an alarming growth trend that will only continue as more vaccines are added to the schedule. Senators, vaccines are pharmaceutical products that injure and kill children every year. This is not an opinion, this is a fact, as evidenced by the government's own reporting system. I urge you to vote no on SB 277 and maintain the personal belief exemption in California. Parents deserve informed choice in their children's vaccine schedules. I would be happy to answer any questions you may have now or at any later time. Thank you very much.